You'll practice using the memory word ABCABS in a cycle of care as you learn emergency first response skills. The meaning of the memory word ABCABS is as follows. Within the AB portion of the memory word, the first A in ABCABS stands for airway. Essentially, the A reminds you to ask the question, is the patient's airway open? Also, within the AB portion of the memory word, the first B in ABCABS stands for breathing. This letter reminds you to ask the question, is the patient breathing normally? If the patient's airway is open, but he's not breathing normally, then you call emergency medical services and quickly move into the cycle of care.
1, 2, 3, 4, 5, 6, 8, 9.
Within the memory word ABCABS, the CAB portion of the word reminds you how to perform CPR. Let's see how. CAB stands for chest compressions, airway open, and breathing for the patient. This is how CPR is administered. You continue with the cycle of care until professional help or an automated external defibrillator, AED, arrives. More on AEDs later. If the patient is breathing normally, you move along the cycle of care to the S portion of CABS. The S in CABS reminds you to look for and treat serious bleeding, shock, and spinal injury. In this course, you'll learn how to manage each of these medical emergencies.